Hey guys, welcome back to the We Care podcast. I'm Casey, nurse practitioner with Direct Primary Care and Functional Medicine.
And I'm Molly, RN at We Care. Today we're talking about something we see all the time: quick fixes versus actually addressing the root cause. This one might step on a few toes, but it's something people really need to hear because, let's be honest, everyone wants a quick fix. Y'all know if there was a button you could press to fix everything overnight, every single one of you would press it.
Everyone, like including us.
100%. We're not immune to that at all.
No.
We've all been in that just give me something that works fast, I don't have time for this mindset. And honestly, there's nothing wrong with wanting results like that. But the problem is when that's the only approach and you never ask why the issue is happening in the first place, that's where you run into issues.
Yeah. And a lot of things we treat like fatigue, weight gain, inflammation, sleep issues, hormone issues, even skin problems, they don't happen overnight. Like it is a process to get there. You don't wake up one day sick. You don't wake up one day with disease. It is a process to get there. And unfortunately, it's not something that can be fixed overnight a lot of times.
Right. And I know people don't like hearing that, but the truth does hurt sometimes.
Yeah. One thing I see on my side is patients who've been given these quick fixes. They've been given medications or just kind of Band-Aids to mask their symptoms, but nobody really digs deeper and tries to figure out the what or the why, to the what, if that makes sense. Like we're not asking very probing questions. We're just giving you a prescription and sending you on your way. Mm-hmm. And then you come back a few months later and you're like, well, I don't feel any better. And nobody knows why.
Right. And I see it in aesthetics too. People come in wanting filler just for everything. Under eyes, cheeks, lips, just any little line that they see on their face. And sometimes, yes, I can use filler in that way, but that's not always the main issue. Sometimes it's poor skin quality. Sometimes it's collagen loss. Lifestyle, stress, even hormonal imbalances will show up in the face. And we've got to address those sometimes before I can come back in and address it on the cosmetic side.
Yeah. I've got a patient I remember in particular, 23-year-old, came to me with horrible hormonal acne, or that's what she called it, was hormonal acne. And I was like, well, let's just kind of dig deeper. Let's look at your gut. Again, I'm, the gut girl. It's fine. But, I said, let's dig deeper. Let's look. And she had a ton of like staph and strep, and whatever's in your gut will show up on your face, especially if we've got a breakdown in that gut lining. And I know we've talked about that before. So when we talk about root cause, again, what is the cause for that acne? We have to look deeper. We have to dig deeper. And it's usually not just one thing. It could be inflammation. It could be hormones. It could be your gut health. It could be nutrition. When's the last time you went to the doctor and they asked you anything about nutrition or sleep? Probably not very often. And that's one of the things that I talk about with my patients here a lot is, well, what does your diet look like? What does your sleep look like? Are you sleeping throughout the night? Do you wake up in the middle of the night? Like a lot of that plays into just overall health in general. And so, I like to dig into the uncool, not quick fix type things that people don't always want to deal with. And it matters because if you don't fix it, then you can't fix everything else.
Right. This is typically at the point where people are coming to us and stating that they feel like nothing works, saying that they've tried everything. And yes, a lot of times they've tried a million different treatments or medications, but no one's just managed to connect the correct dots yet.
Right.
So with all of that being said, we are not anti-quick fix. Botox, that can be a quick fix. And we all know I love me some Botox. So, but there's times where quick fixes and you still have to look at root cause too. So I'll have patients come sit in my chair that have never had Botox before. It's later in life and they already have at rest lines etched in their face. So this is where you have to kind of have a multi-combination treatment effect or kind of process for them. So yes, Botox is going to help. It's going to paralyze that muscle movement. So it's going to stop them from making those lines deeper or adding new ones. But you've also got to work with something else more long-term to correct what damage has already been done to the skin. They need their daily SPF. They need to use some sort of a chemical exfoliant, microneedling, chemical peels, lasers, all of those things in combination with the Botox that works faster is what's going to make their skin quality overall better in the long run. Another thing that people will kind of come to us thinking is a quick fix is GLP-1s. And they're not quick fixes. Yes, they get in your system quick, but it is just a tool in the toolbox, and it's not a super fast thing.
Yeah. And, I feel like the best outcomes happen when we use those tools in our toolbox. And so going back to your GLPs, I've got patients who come to me and they're like, oh, well, my friend lost 80 pounds on a GLP and I need that. Like you're right. You probably should lose some weight based on, your BMI and I hate BMI, even hate to bring that up, but because it doesn't factor in muscle and things like that. But, if we've got metabolic issues, if our fasting insulin levels are high, if we're a diabetic, if there are lots of things that play into GLP-1. So I'm not anti-GLP-1, but again, it's a tool in our toolbox because if you're still eating like trash, then it's not going to help. And it may help, but when we come off of it, we're going to lose all of our weight or gain all of our weight back. Sorry. And so again, you have to know when to use those tools.
Right. In the right way.
Right.
Yeah. So, and that's the difference. There's a quick fix and then the root cause, a quick fix with root cause. That's, where we can find longer lasting results.
Yeah. And that's really the model that I like to live by here. And that I feel like everybody lives by here is, we're not just handing you something and sending you on your way. Like we're actually trying to figure out, again, the why behind the what.
Right. So, and honestly, this is what a lot of people are used to before they come to see us is just kind of a quick fix sent on their way. They're used to very fast appointments, quick prescriptions, quick treatments, and then they're left trying to figure out the rest of the reasoning for why they feel the way they do on their own. Doom scrolling on TikTok, trying to self-diagnose, and it's just, kind of a spiral effect.
Yeah. And I feel like it's because people are so desperate for answers because they haven't been given those answers. And so all they know to do is turn to ChatGPT, turn to TikTok, turn to Instagram, and start like just Googling their symptoms, hoping and praying for an answer because they haven't had anybody that looks at the root cause for their dysfunction. And so long-term results come from understanding your body and knowing that your body is not the same as mine and is not the same as Jordan's. And what works for me may not work for you, and what works for you is not going to work for Jordan. And so it is very personalized. And again, it's your root cause is not going to be the same as mine.
Right. And that's what we're trying to do differently here. Look at the full picture, how you feel internally, what's going on with your labs, your lifestyle, and then also what's showing up externally on the skin.
It's all so connected.
It really is. So if you've been stuck in that cycle of trying things that only work temporarily, or you feel like you're constantly starting over, it might be time to come see us and dig a little deeper, and not in an overwhelming way, but in a way that actually makes sense.
Yeah. And again, that's what we do here. We like to dig a little bit deeper. So that is going to wrap up today's episode. So tune in for the next one.
Make sure to subscribe, share this episode, and follow We Care Health and Wellness for more education and behind the scenes content. And don't forget that at the end of the day,
we care. See you next time.